morning. Everybody right to go? Thanks very much for being here. There are 19,800 aggregate confirmed cases of coronavirus since the beginning of the pandemic. That is just 37 new cases since yesterday's report. I'm sad to have to update you that now 716 Victorians have died because of this global pandemic. That's an increase of 6 since yesterday's report. 2 females and 1 male in their 80s, 2 females and 1 male in their 90s. We of course send our sincere condolences and sympathies to those 6 families. All of those deaths are linked to aged care outbreaks. There are 126 Victorians in hospital. 9 of those are in intensive care and 6 of those 9 are on a ventilator. Those numbers continue to steadily fall, and that is great news for every Victorian, but it's particularly great news for those in our hospital system who are caring for those patients. Obviously, if we've got less people hospitalised because there's less people who are gravely ill, then that means one of the contributing factors to health worker infections is obviously at a reduced level. There have been a total now of 2,471,377 tests. Results that have come back to us since the beginning of the year. That's 14,453 since yesterday. So those numbers have steadily, corrected, if you like, from quite a low number on Monday. We thank each and every one of those almost 14,500 Victorians who went for a test yesterday. It's a massive contribution that you're making, and again we'll make the appeal. Any symptoms whatsoever, as soon as they begin, please get tested. There's more than 200 sites across the state, and if your personal circumstances mean you can't get to one of those sites, we will in fact come to you and conduct the test in your home. There are 4,296 cases with an unknown source. That's a decrease of 7 since yesterday's report. 194 healthcare workers who are active cases. We thank them for the work they're doing and all of their colleagues, and we send our best wishes to them for a speedy recovery. There are 1,251 active cases across the state. In terms of the regional metro split, I'm very pleased to be able to update you that there are now just 58 active cases in regional Victoria, in all of those local government areas that are covered by stage 3, and no new regional cases since yesterday's report. In terms of the Echuca issue, which I think most of you have been brought up to speed on that, but we're very pleased that was a false positive, and that then does not mean that there's any change to the likely, in fact nothing certain, but regional Victoria remains on track to be open to take not 1 but 2 steps by, say, the middle of next week. That is proof positive to every single Victorian that we can drive these numbers down, we can open up, we can do it safely, and I want to congratulate and thank every single regional Victorian for the part they're playing in that. And of course, to see these numbers into the 30s, it was only 5 weeks ago that we had 725 cases on a single day, to now be down to 37 cases. These numbers will jump around a bit, but the trend is with us, the strategy is working. People can be hopeful and confident and positive that we will be able to take these steps. You can only keep numbers low if you first drive them down to very low levels. That is exactly what is happening, and that is good news. It's challenging out there, I know it's difficult, but the strategy is working, and that's something that is altogether the product of enormous sacrifice and hard work that each and every Victorian who's following the rules, playing their part, that work is what's driving these numbers down, and it makes you proud, and I'm absolutely grateful to every single Victorian who's doing that important work and staying the course so that we properly defeat this second wave, can open up and stay open. That's the strategy, and the strategy is delivering results. I just wanted to talk, so the rolling averages, 61.6 in Metro Melbourne, out from 29 August to the 11th of September. Regional Victoria, they're down now to 4.3. That is very, very good news for regional Victoria, and I hope every single person in Metro Melbourne is looking to the numbers in regional Victoria and seeing what can be delivered. Absolutely, this strategy can be delivered, and it is being delivered, and regional Victoria is so close, just a few days, and they will potentially be able to take not just 1 but 2 of those steps and be essentially open. I'm very pleased to now give you a couple of updates on some issues that have been quite topical. Firstly, in relation to pet grooming, When Metropolitan Melbourne enters into the second step, so 28 September, that's our likely trigger, pet groomers will be permitted to provide contactless service to their clients, to their animals. Pet owners will be able to drop off their pets to the venue. There's no mobile. Mobile was not judged to be safe at this time by the public health experts, but fixed sites, so businesses where there's a retail premises. Pet owners will be able to drop off their pets to the venue and then pick them up when the service is completed. It must be a venue. It cannot be a mobile pet grooming business. This is very similar to what veterinary clinics are already doing in some circumstances. That's how they're operating across the board. And pet grooming is already permitted in regional Victoria, as we know. The second issue where we have, following a lot of consultation and feedback and some detailed health advice, making some very careful assessments and judgments about risk, is beauty and personal services. Under the roadmap, hairdressers are listed to open in Metropolitan Melbourne under the third step, and beauty and personal services to open under the last step, so they were later than hairdressing, pretty much in that COVID normal phase. Following some further consideration and public health advice, I can announce that beauty and personal services where a mask can be worn for the entire time that the person is getting the services that they are accessing will be able to proceed in the third step alongside hairdressing. So beauty and personal services where a mask can be worn will be in line with hairdressing in the third step and not at almost the last step of our roadmap. This means that services such as facials, face tattoos, face piercings, they cannot occur because a mask would not be able to be worn while those services were being administered. But other services will be able to be provided. In regional Victoria, hairdressers are already open, but beauty and personal services won't be far away with those points I made before about regional Victoria taking potentially in just a few days' time, not one step, but in fact 2 steps. So we will bring across regional Victoria as well beauty and personal services where a mask can be worn in line with hairdressing. That could be as soon as next week. We'll provide all the exact wording up on the website so there can be complete clarity, but I thought it was important to make those 2 announcements and update the rules as they apply and the roadmap as laid out. Can I just, there's been many in the beauty and personal care sector that have been working with us, and I want to thank each of them for their very constructive approach they've taken to trying to make sure that their facilities can be open as soon as possible but safely. That's really very valuable. And can I thank Andy Medic from the Animal Justice Party, who has made a very passionate and a very effective case to us in relation to animal welfare, and an issue that might seem trivial to some, but it is very important from an animal welfare point of view that we can have that pet grooming where it can be contactless, where it can be safe. And I want to thank Andy for his very constructive approach and his partnership on that issue. Now, just finally, before I ask Brett to add to the epidemiology of the day, a couple of points. We're putting up on the website this afternoon some household COVID-safe planning hints, tips, a bit of a structure, a bit like we do when it comes to individual households being ready for the fire season each year. A lot of this is just common sense, but it's really, we've had a lot of people come to us and say, look, what can I do? What might I be able to do to make my home even safer and to be ahead of those household bubbles and more people moving in and out of your house? So it's just a really practical way that we can provide some structure and some support to households who are wanting to do everything they possibly can. We're very grateful for their interest and their absolute commitment to being as safe as possible, and that'll be, I think, a useful guide, just like the bushfire safety sort of information and planning tools that we put out each year. I just now want to deal with mental health. I was asked the other day in relation to if we had any numbers, any trends in relation to the number of people that are presenting for mental health care. That covers a whole spectrum. Some people who had mental illness prior to the global pandemic, some people who are experiencing mental illness for the very first time, some people who have relatively mild mental health issues to deal with, others who have become acutely unwell. We've made around $200 million in additional funding announcements. That money is out there in services across the whole scope of mental health care. But I just thought I'd give you a few. I've got some very recent data up to the 7th of September. So I'll run through a couple of those statistics just so people can be informed about some of those trends. They're very important. 26.7% increase in young people presenting to emergency departments for intentional self-harm and suicidal ideation over the past 6 weeks. That is of great concern to us, obviously, but it compares, if you look at the same 6 week period that is compared to the same 6 week period last year. If you look at the numbers on the 9th of August, so go back a month, that is down from a 33% increase. So whilst every single young person who's vulnerable, every single young person who's experiencing those sort of challenges, they're critically important to each and every one of us, the trend there is actually coming down, which is a good thing, and the additional resources that we've provided into hospitals will be, and mental health services will be, very important for many months to come. A 10.5% increase in all people presenting to emergency departments for intentional self-harm over the past 6 weeks compared to the same period in 2019. 5.9% in presentations for urgent and emergency mental health services over the last 6 weeks. That is down from 19%, so 5.9% down from 19% when we provided an update on the 9th of August. So again, that trend is a positive one, albeit these are all very serious matters and have to be appropriately supported. 10.8% more people are contacting services for inpatient or residential program care compared to the same point in 2019. That number is basically stable. Of course, there are more people seeking care. They're getting that care, but we have had, across this year, there's been many concerns raised in relation to whether people were coming forward and getting their care, whether they were compliant with their treatment plan, whether they were perhaps missing out. Those numbers support the fact that many more people are getting the care that they need. Just finally, 30.6% increase in mental health support by telephone, and we thank all of those services, all of our partners that we've provided very substantial additional funding to. That 30.6% increase in telephone calls, so volumes to those calls and services, that is compared to the same period in 2019. And there are 3,093 additional video and teleconferencing sessions a week, up from less than 100 a week back in January. So in each of these areas, there is significant demand, there is significant challenge, but additional funding, additional effort is seeing that trend move in a positive way. But of course, every single person who's in crisis, every single person who needs support and care are very important to us, and will continue to receive the very best of care we can possibly deliver. But I just thought it was appropriate to update you on some of those trends, given that a number of you had asked about that very matter. I'll now ask Brett to add to my comments, and then we can take questions.
Thanks, Premier. Basically, just trending down across the board. Obviously, an overall increase today of 33 with some reclassified cases. That's the lowest we've seen for weeks and weeks. The numbers in hospital in ICU on ventilators are at their lowest level for several weeks as well. The same applies to active cases, now down to 1,251, and as the Premier said, really on track in regional Victoria to hit the targets that will allow a jump of a step and to significantly open up, all things being well, over the next few days, in terms of not having cases that have unknown acquisition or mystery cases, but they have gone a significant period without that. They're obviously at a daily average which is below 5, and with every expectation it'll remain there. That said, there are a few hundred cases that are a few hundred close contacts of those active cases, and they'll need to go through their 14-day period. So there might be some additional cases that we can and should expect in regional Victoria, but we want them to be associated with known active cases or known outbreaks, so that we can be satisfied that we're tracking each and every one of them and that there aren't these further mystery cases. But it's absolutely on the right track, and everything that regional Victoria has achieved is of their own doing, following the rules and really putting up with these significant constrictions has got them to the point that they're at now, and with a pretty positive path ahead. They've been supported by everything that's been done in Metro Melbourne, because the number of cases that are linked back to Metro Melbourne has decreased very significantly over time. So there are lessons there for us here in Melbourne, that you can go from 512 active cases in regional Victoria to numbers in the 50s, and be on track to have no new cases over the coming fortnight. That is not beyond the possibility, and Metro Melbourne is also tracking extremely well in that regard, which is showing up in how our health services are eased, and the number of active healthcare workers dropping below 200, and the number in aged care also well down on where it's been in recent weeks. Thank you.
What is that number on aged care? I'm not sure whether the Premier is.
Active cases in aged care. You've got it? 625.
Professor, in a nutshell, can you explain what is the final trigger for you for pulling the trigger on changes in regionals? What is the final bit of information you need? And also, in a nutshell, can you explain if they jump 2 steps, what does it mean they'll be able to do?
So really, we've laid out those thresholds, which is being below 5 new cases per day over a 14-day period. It's below that now. They would need to have significantly more than 5 in the remaining days for it to head up above 5 again, and for there to be no mystery cases or cases of unknown acquisition in that same 14-day period. When they meet that target, they don't just go to what was flagged for changes for September 14, but to significant operational changes that the Premier's listed some of today.
And do you treat those really small towns that have obviously never had any cases at all the same as somewhere like Geelong?
I think we have to. I think we need to recognise that we only know about cases that are notified. Cases that are notified are only about people who step up for testing, and there can be cases out there that are not known to us because people haven't tested, because they've had very mild symptoms and haven't sought care and sought testing. So even if there have been areas with no cases, they'll be treated the same as the rest of regional Victoria. But the wins are for the whole of regional Victoria, because they've been under these restrictions, and it's driven transmission down. And there have probably been cases there that have never been discovered, but those chains of transmission have nonetheless ended because these restrictions have been in place.
So will the decision be made on Monday for this?
Look, I think we can follow each and every day. We'll need to absolutely get to Monday to see that. I don't think we could call it today, for example. I do think we have to go through the weekend, see Monday, make sure that there are either no new cases, and if there are new cases, that we can really rapidly ascertain where they've acquired it, and hopefully they're in known close contacts of active cases, so that we can link them immediately and we know that they're contained.
And so when's the soonest do you think that they could have those 2 steps taken?
Well, we'll write the public health directions as soon as possible after that time, but we do need to be assured that they've met that threshold in the first instance.
Professor, the team of Victorians that's arrived in New South Wales to talk about contact tracing,
Yep.
has any information flowed back as yet?
No, look, nothing back immediately. I think it was a very constructive time spent on both sides. There are lessons to learn for New South Wales as for Victoria. As I've said earlier, there are things in Victoria that we're doing better than anyone. I think Operation Vestige, where the door knocks are occurring immediately for close contacts and for cases, is a very useful addition to all of the telephone follow-up of cases and close contacts, both for those who haven't picked up the phone or who we haven't been able to reach, but also as that routine and regular check-in, sometimes to complete some details of the interview that couldn't be completed over the phone. So I am sure that there'll be lessons learned for us, but the same for New South Wales, no doubt.
The team at Melbourne Uni who did the modelling, they say they've been misrepresented and they're asking for changes because they don't think these targets are attainable.
Well, it's not us representing University of Melbourne. If they've been misrepresented, it's in assuming that the only inputs into the policy decisions that we've made and the thresholds that we've made has been based on that modelling. That modelling was a really significant and core input into decision making for policy decisions, but it was by no means the only one. There have been lots of other inputs, and of course it's been the experience of watching the numbers both here and in other jurisdictions to see the kind of levels you need to get to be happy that you can sustain those very low levels of transmission or get to no transmission if you can.
They say the only place where that has worked to get down to those targets has been Wuhan. That's got to be alarming.
No, I don't think that's true. Wuhan obviously had very significant numbers, but they got to 80,000 cases in that city. We're not at that level. We're not going to get to that level, so we're in a better position in that regard. And there are jurisdictions, island states essentially, with lower numbers than we've gotten to, who got to the point where they have had long-term maintenance of very low numbers or gotten to no community transmission. But we're at a point now where we're at 30 odd cases a day, so it is within our grasp. And we'll be realistic about how it's tracking. We won't just say the modelling tells us this and we will move at this point. We will follow those numbers every day. If we get to a point where it is clear that it is not possible to get to no community transmission, we'll make a call on that. And it is also possible that we will get to a point where the numbers are higher, but we will investigate those numbers, we'll see where they're occurring, why they're occurring and how they're occurring, and make a judgment about whether 5 is the appropriate target, or if it's 10 cases a day but 8 of them are in aged care, and that's not inconceivable, that we will absolutely focus our attention on containing all transmission within aged care, but otherwise lifting for the community. But they're judgments to make down the track, and we'll do it on the basis of how things are going over the next few weeks.
The suggestion from this epidemiologist is that instead of that 5 being the threshold, move it to 10, and that makes it a little bit more realistic, potentially sooner. But the difference between the percentage of risk of a third wave coming through isn't that much. Can you explain if that's actually the case?
Well, I think that the judgments that we're making are based on the modelling, but other experience in Australia and internationally. And again, the risk tolerance you might get to will be different for different people, but the risk of a third wave is not one that you would want to tolerate at 60%. You wouldn't want to flip a coin on it. You probably wouldn't want it at 20% because of what it means to get there. But I'm talking to Tony this afternoon. We will sit down, we will make further revisions of modelling, and we'll re-prosecute the inputs and the assumptions and follow the real data as we go, and we can make judgments that are different at different points in time. But the importance of the roadmap was to lay out some general movements in those directions and to have some really strong indicative numbers so that people understood where we were heading. And people might have said that regional Victoria was not going to get to this point this week or next week, but here we are.
So when you say that you'll make further revisions after speaking with Professor Blakely later, are you saying that potentially the triggers that we saw in the roadmap last week could be changed?
Well, it's entirely possible that the new inputs into modelling, and they're always informed by changes in what we see on a day-to-day basis. And so there might be new probabilities that are generated in that modelling. We'd reflect on that and we would make changes as appropriate.
New South Wales recorded 24,000 tests on Thursday, the 24 hours to Thursday, and we are about 10,000 fewer than that. Can we have confidence in the low numbers?
We'd certainly like a lot of testing to be done. I think we've been doing such a fantastic job, and testing really is our pathway out of this. So we have to know where cases are to be able to control this, and there is a risk when people don't test and when transmission occurs, or if it's delayed, that you can get these significant outbreaks, and that will be true in regional Victoria as for Metro Melbourne. So absolutely we'd encourage it across the board in Victoria, and I'd say particularly for regional Victoria to protect it, because there are still essential workers, there are still people who move into Metro Melbourne for essential reasons. So anyone who's symptomatic, but I would call out anyone who is coming into Metro Melbourne for essential reasons, if they develop symptoms, to be acutely aware of the need for testing, because we will get on top of it very early if people test. So absolutely encourage further testing.
Is there a figure that you consider to be the right number of tests to be giving the right indication or an accurate indication of how widespread it is?
Not really. Look, I'd be disappointed if it stayed below 10,000. I'd be happy if it were above 20,000. But there's no absolute magic number there. It is about having an appropriate match of where transmission is highest to make sure that testing is really good in those areas. And we've had some cases recently in Hobson's Bay, in Hallam. I'd encourage people in those areas in particular where we've called out some cases to particularly step forward for testing. But we do want a baseline level of testing across the board, because you never know if there's a case out there that hasn't been detected.
Professor Sutton, you were quoted in the Saturday paper as describing a contact tracing system as a total hodgepodge of private and public providers that are not able to be stewarded centrally. We've seen failures in outsourcing hotel quarantine to the private sector as well. Would you prefer to see the money coming in-house to the Department of Health?
So that wasn't about contact tracing. That was about the fact that there are private pathology providers who operate across Victoria, and we've worked extremely hard to align the testing that's being done across those providers so that the turnaround times, which have come down significantly from a couple of days to under 1 day for the majority of people now. So it is improving, but it wasn't a comment about contact tracing at all. And I think the idea that you wouldn't go to external providers for additional surge capacity is silly. You would absolutely go to external providers when you need a surge capability, and that's what we've done. And the Whisper system is an example of an IT innovation that made a big difference in contact tracing early on, from March onwards in Victoria.
You said yourself that even at lower numbers there were some intrinsic challenges with contact tracing. Do you think those have been resolved?
Well, we've always talked about the improvements that have been made over time, so it's not news, to be fair, that we're at a better point now than we've been at any other point with contact tracing. So those challenges have been spoken to in some of the improvements that we've made in recent weeks, which include IT improvements, but also the beefing up of numbers of people who are on the phones, who are doing interviews, the way that notifications come in and the like. So I think we're absolutely in a better position. But we had to move through that. That was, there were complexities to work through, and it takes time and effort to get to that point.
Can you explain the thinking behind realigning beauty services and personal services with hairdressing? There has been a lot of outcry in the community saying they were the ones that have all these really strict hygiene measures already in place, perhaps even more than hairdressers. How come a rethink?
Well, certainly hairdressing had been a decision of National Cabinet. There was obviously a view that it was an important service to provide. Everyone understood that there was a certain risk associated with it because of the close contacts between a hairdresser and a client. The same challenges apply in personal care and body art services, but we did want to really investigate what those risks were, what the experience of outbreaks or transmission were in Victoria, but also internationally. And the fact is that if both the client and the service provider can wear masks, then you really significantly mitigate that risk. And there are some services like manicures and pedicures that won't be a very long period of time, even in comparison to hairdressing. So, we think on a relative scale of risk, and because local government registers these settings and environmental health officers can inspect as well as WorkSafe, and that there's a register of names of clients who attend, that all of these things in place really means that it should be lifted up to the same level as hairdressing in terms of coming in at that step 3.
In terms of continuing to monitor the thresholds, has anything changed in terms of when the roadmap was first outlined? It seems as though the 5 cases is moving more than it had been a week ago. Is that the case, and if so, why?
No, I don't think so. But in talking to the modellers, and we've spoken to not just the University of Melbourne modellers, but modellers at Burnett Institute and the Peter Doherty Institute, they shared lots of insights, and they want to have an ongoing conversation with each other and with us. But one of the things that Uni Melbourne reflected on was that they can't easily dig into different transmission for subpopulations within a broad Victorian population. Their modelling kind of makes a homogenous, one size fits all. With individuals with different characteristics, it's an agent-based model that says, here's an infectious person on day 1, here's a less infectious person on day 5, people of different age moving together in different ways, but they haven't gone to some of the realities in Victoria in terms of our aged care transmission. And I think that's another step to input into the model as best can be done. They need to access the data and to be confident that it's telling the right story there. So we'll continue to investigate it. But there's no significant shift on the 5 at the moment. I think we can get there, but we should be realistic about following the numbers, not just following the modelling.
Do you think contact tracing in aged care settings has been successful?
I think in a way contact tracing doesn't happen in aged care. You get the first notification in a staff member or in a resident, and then everyone is in lockdown effectively, and then everyone is tested immediately, and then there's day 11 testing for everyone as well. So the most critical step for aged care is for anyone who's symptomatic to get tested as soon as possible. And that hasn't always happened quickly, and we want to absolutely encourage staff in those facilities and for surveillance of residents so that people can be tested at the earliest possible symptoms. But in terms of notification to us and to the facility that there's an outbreak with one case, that's happening at the same time as notifications are coming in. But the challenge is, if someone has been symptomatic for 3 days, if a resident's been symptomatic for 3 days and potentially wandering around, that's a lot of transmission before it's even been notified. So we need to shorten those times as much as possible.
Professor, I'm not sure if this is a question better for you or the Premier or both, but who set the 5 target for the easing of the most stringent lockdown?
Look, it's the advice of the public health team that I lead. But it's a discussion with Cabinet, and I think the Premier can speak to the broader decision making around that. But we obviously reflected on a whole number of things, and there were some recommendations that the public health team made from that point of view.
Premier? Sure.
I've said many times this week, and I'll make the point again because I think it's an important one, data trumps modelling every time. Actual numbers, like so today's numbers, not what we thought we would have today, but what has actually been delivered, and all the detail, the narrative that sits behind each of those cases, that is much better than any assumption you can make. And that's why the modelling gets updated. It'll be rerun, not on what we might predict will happen, but based on what has happened. And every day that passes, we have more data, we have more actual data to put into all the different assumptions that have been made. It's a rigorous process. I've also made the point a few times that we have a great medical and scientific community in this city and across our state, and there are many different views on any given subject, and that's a perfectly healthy thing. But at some point, you have to call these things. This is not an academic exercise. This is live. It's real, and we have to lock in some settings and then push to achieve those targets. On the issue of the achievability or otherwise, we will keep putting the data in every single day. We'll keep running the models. We'll see how things unfold day on day, week on week, and we'll use common sense. If it became clear at a point that the tail of this second wave was more stubborn than even the most rigorous modelling tells us, well then of course we would look at that. We would of course look at that. You've got to get these numbers low though, Nick, if you've got any chance of keeping them low.
But this is a bit different in that they say they've been misrepresented.
Well, I think that Professor Sutton has dealt with that.
There'll be misrepresented them, do you think? Or do you think you might have created the impression?
Well, I don't know that they've necessarily made that claim against me, but to the extent that they have, that no, that's wrong. We've put together a roadmap with a series of safe and steady steps to open and stay open. We've at no point said these are stone tablets and can never be changed. In fact, we've been at pains to make the point, as each day passes, the actual data, not what was presumed, but what has actually occurred, gets put into this, and the modelling, the process will be rerun to see where we are in real terms and where we are compared to where we thought we would be. Assumptions are always beaten by the actuals, and that's why this is a constant, iterative, developing process. It's not set in stone, and we have to wait and see exactly how successful are we against all the targets that we've set. They're targets. The point that was just made a moment ago, many people would have thought that it was less likely than likely that by the middle of next week, regional Victoria would have such low case numbers that they'd be able to take not one step, but in fact two. That looks to be, as we stand here today, that looks to be exactly where regional Victoria will be in the middle of next week. So you can get these numbers down, and you must get them down if you've got a realistic chance of keeping them at very, very low levels. In other words, opening and staying open. All of this data, all the tools that we use to try and predict what would happen, it's all updated continuously by what has actually happened. The actual numbers each day inform the model as it gets run and rerun, and that'll be a process that'll happen over the weeks and months to come.
So
and indeed once we're open.
So
also.
almost a week on from you releasing that roadmap, the figures that you've seen since then, should Victorians and particularly Melburnians be feeling like those targets are still as
Absolutely.
they stand, or should we be feeling hopeful that maybe they could be brought forward?
No, what I'd say is this. I think everyone in regional Victoria should be proud and should be congratulated for the job they've done, and it is middle of next week, every chance. We're just days away from regional Victoria being able to take not one but two steps. Everyone in Metro Melbourne should look to that and say, yes, this can work, this can be done. You can get numbers down and you can keep them down. And to have just around 50 active cases in regional Victoria today, when we had more than 500 not that long ago, to have Melbourne cases in the 30s when 5 weeks ago they were in the low 700s, every single Victorian can be hopeful and positive that this strategy is working and we will hit our targets. And if we can get there beforehand, absolutely. If on the other hand, this thing proves to be more stubborn than we thought it would be, we will factor that in, of course. And then there's also the finer judgments. You might get to the end of a 14-day period, 6 or 8 cases come in. If they were predominantly in aged care, or if they were one family where we had absolute confidence that we'd locked it down and it was contained to that family, then the public health team would work through in a very detailed way. It's not just numbers, there's a narrative, there's stories, there's the circumstances behind every one of those cases, and we would look through that in fine detail, and then the public health team would make a judgment.
In that vein then, Mildura hasn't had a case for something like 5 months. They're obviously a long way from a lot of the hotspots that have been a
Sure.
real concern. Would you ever consider looking to put them outside of Victoria's
Sure.
restrictions?
Let me go back to this. This has been a point that's been of some concern all week. If we had been asking regional Victoria to wait 6 or 8 weeks to move as one, then we wouldn't have done that. We would have said, right, we're going to have 6 or 8 zones. We're going to have to divide regional Victoria up. But because we knew that if we stayed the course and we stuck to the strategy, there was every chance that within 2 weeks of having announced the roadmap, middle of next week, it'll be even sooner than that, we could get to that point where there were less than 5 cases and no community transmission, no mystery cases. We thought it was best not to divide regional Victoria up, have people barely acquainted with the rules that applied to their local zone, only to have the numbers such that every regional Victorian could move beyond those rules. If it was 6 or 8 weeks, it would have been a different story, but it's not. There's every chance. In fact, it is increasingly likely. I'd call it if I could, but I don't know what will come in tomorrow or the next day. But by the middle of next week, indeed early next week, I think that regional Victoria is going to be able to take those steps. And that means all of regional Victoria moves as one, and there's no need to do subsets, there's no need to do zones. And there are some very practical issues with that, around how do you police those roadblocks and all those sorts of things. It's not like it's an 8-week journey. It might only be 8 or 10 days. We'll just have to wait and see how the numbers unfold over the next couple.
Premier, you mentioned that it's not an academic, we're in a real setting, not an academic setting.
We are.
But that modelling obviously has to be done in an academic setting. So what's the
Yes.
process for them taking that information and turning that into to what we're living through now? Like, what's the process for taking the information they're giving you and making these decisions?
Well, they provide their modelling to the public health team. The public health team then sit down with us, sit down with me, ministers, senior officials, and work through how do we get the most economic benefit for the lowest public health risk. So that's why there's, if you asked a public health official, should we have the 101,000 people going back to work, the answer would probably be no, because that would be an absolute. But they know, they're practical people. They are doing, as we are, the very best we can to strike that difficult balance. Lowest public health risk, highest economic return, as well as some things that are not financial, for instance. So trying to have people being able to connect singles bubbles, family bubbles, those sorts of things. They're very difficult judgments, but the public health team use all the inputs they have. They play a part in helping the modellers to try and consider as many variables as possible, and then it kind of works up from there. And there'll be lots of different options, and there'll have to be some very fine judgments made. There have already been, and there will continue to be, when it comes to, for instance, the announcements I've made today about pet grooming from an animal welfare point of view, and beauty and personal services being aligned with hairdressing. That's not quite as simple as it seems. I know there's been people sitting looking at that in some detail for quite some time, quite a few days, in order to have confidence that we could make that announcement.
Well, the curfew was one of the biggest decisions from all of that. How was that reached at? How did that go from being an academic exercise to being a...
Well, that was never an academic exercise.
How was that decision?
Well, that was never an academic exercise, and it's not a matter of public health advice. It's a law enforcement issue. It is about making sure, and as I think Assistant Commissioner Cornelius has made it very clear yesterday, I'm not going to ask police to spend hundreds and hundreds of hours clearing out Macca's car parks in the suburbs with pop-up gatherings, illegal house parties. The list goes on and on. None of that is conducive. The drags down at Springvale Junction where I live. All of that is a waste of police time, and it is doing nothing but spreading the virus. That's not happening now. We've seen with the traffic modelling yesterday, we've seen a dramatic reduction in the number of people moving around. And the only reason you would be moving around where the curfew would be a problem for you would be if you were moving around for illegal purposes. So if you've got a lawful reason to move around between 8 and 5, soon to be 9 and 5, then the curfew doesn't actually impact you. It's about giving police the easiest set of rules to enforce, and it's about making sure the police are not having to waste their precious time dealing with things that shouldn't be happening and can easily be prevented by putting a curfew in. Not for a day longer than it serves its purpose, but certainly the feedback that I've had from police members, many of whom I speak with, they're having a difficult year, they've got a difficult job, it's never easy, but it's made somewhat easier by the curfew being there.
Why didn't you consult with the Chief Commissioner then before?
Well, I think the Chief Commissioner and Victoria Police were spoken to hours before the decision was made, and if I can, with the greatest of respect, make it clear to you that 5 or 6 hours in this thing is like a week. Sometimes you don't get 3 days to ponder something. But I'll just take you to Assistant Commissioner Cornelius's position yesterday. He couldn't have been clearer. This is exactly what we need to do, and it will not be changing. It will not be changing. We will have it there, as we've indicated, because it is serving a purpose, it's doing its job, it's limiting movement, and you will not limit this virus unless you limit movement.
But it is such an imposition on civil rights in normal times. It just seems strange that...
But hang on, Nick. It just
seems strange that you didn't discuss that with Mr Patton before.
I'm not saying that's the case at all. The Victoria Police, and I've kind of covered this a couple of days ago, but I'm happy to make the point again. Victoria Police have had many very consistent views on things they have consistently reinforced with us. Give us rules we can enforce. Make the enforcement task as easy as possible. Curfew does that, absolutely does that. So it delivers on exactly what they have sought again and again, because that's their job. They want easily enforceable rules. And on the broader point about this being about someone's human rights, this is about human life. And if I sit here and try and list for you all the people that are disadvantaged by that curfew, let's just go through those quickly. If you've got a work permit, curfew does not apply. If you need urgent care, curfew does not apply. If you want to go for a jog at midnight, sorry, you can't. If you want to go shopping at midnight, sorry, you can't. The other point to that is to just remind everyone that supermarkets have been closed much earlier than that hour, well before the curfew came on. So I don't see. Yes, there'll be some burden for people who might want to go for a run in the middle of the night or try and go to a supermarket that isn't open. But let's be clear, the benefit here far outweighs anyone's human rights or any impact on them. Because there's so few reasons, Nick, this is the point, there's so few reasons to leave your home unless of course you want to go to an illegal party or go to a fast food car park and basically have a gathering that is against the rules, or any of the other sort of behaviour that we've seen. That is hard to enforce unless you've got really simple rules. That is the start and the end of it.
Premier, the Human Rights Law Centre has suggested the curfew might not be lawful under the Victorian Human Rights Charter, which requires restrictions to be reasonable and at the lowest level possible.
Well, I'd indicate to the Human Rights Law Centre that under a state of disaster, which is another act of the Victorian Parliament, those considerations are not the first ones. They're not the main considerations. I think human life, getting case numbers down, having less people become gravely ill and die from this virus, and then getting to a point where we can open up and stay open, that is far more important. Far more important, of a magnitude I can barely describe how much more important that is. This strategy is working, and one of the reasons it's working is that so much of the activity that we did see earlier on isn't happening now. People are not, you can't say 100%, but people are not out and about doing things they shouldn't be doing. Quite selfishly, putting at risk all the great work that everybody else is doing. That's the key point. The sacrifice Victorians have made have to count for something. And unless you have easily enforced rules and police with the determination to do their job, and we have that, and I'm very proud of them for the work they're doing. But you've got to give them the simplest rules possible. And that's exactly what the curfew does. And I apologise to people who can't go for a jog at 2 a.m. And I apologise to people who might want to go and do their grocery shopping at midnight and they are not able to do that. But the benefit far outweighs any cost or any inconvenience for those two groups of people. And I can't think of a third group who would be able to go lawfully under the rules, outside their home, within curfew hours. I can't think of a third group. It's working. So let's not change something that's working because other people who are not burdened, can I say, by actually ever having to make a decision, they're commentators, they've got an important job to do. You go and do that and we'll do the real work that matters to get this place open and keep it open.
Premier, on the pet grooming, was that change granted to secure anti-medics both the emergency powers?
First he heard of the decision was when I rang him this morning, because he's lobbied on it. He's been absolutely critical about it. Never been discussed with him. I spoke with him this morning, literally 5 minutes before I walked in here, because given the stance he'd taken on it and the very productive way in which he's passionately argued on that issue, I thought it was appropriate to tell him. That was the first conversation I've had with him about it, and I don't think anybody was talking about these matters with him before recent days when once he saw the roadmap and said, oh, actually there's some animal welfare issues here. So that is in no way accurate.
Premier, sorry to step back.
Is the government still consulting on hospitality? Is the government still
Yes.
consulting with that industry? And
We
can
are.
they be hopeful of any revisions to like the ones we've seen with the beauty industry this morning?
Well, we'll have more to say in relation to trying to support outdoor drinking and dining, moving, and I think changing probably forever the way some parts of the city work. We'll have more to say about that soon, and we'll have more to say about business support soon also. Final touches are being put to those packages of support. They are very significant, and we'll have more to say about that soon.
Premier, just to follow on from the question I asked Professor Sutton earlier, who set the limit at 5 for the easing?
Public health advice. So the public health team will
So they set the number 5?
Yes. They certainly provided advice. we won't play word games, but let me just be completely clear. The advice comes from the public health team. These are the steps you should take. The ultimate decision, though, is made by cabinet. So just not to be any confusion, but the advice. It's not like ministers sit around and try and pretend to be doctors. We don't do that. We've got a very big and highly expert team of public health advisors. They go and seek advice and input from others who are data scientists, for instance, and people who have a different set of skills. The ultimate decision is ours, but they're made on the advice of the public health team. And again, I'll just make the point, because it is really important. The actuals always beat any assumptions you make. So as each day passes, we put the actual real data into all of our thinking, and the models will be rerun, and we will see, A, how much progress we're making, B, how stubborn this thing is, and we'll also look in fine detail to the circumstances behind each and every one of those positive cases. That is not an easy task, but of course when you get numbers low and you're aiming to keep them low, you have to try and understand as much as possible about each one of the positive cases that come through each day. It's a big job, but look to what's happening and about to happen in regional Victoria. Every Victorian can be hopeful and positive. We are going to deliver this strategy in regional Victoria very soon, and that should be a clear indication to every Melburnian that we can get the numbers low and we can keep them low. That's what we want to aim. That's what we aim for. We want to open up and we want to stay open. We do not want to be bouncing in and out of lockdowns, and that's what we're determined to deliver. There'll be many different views about that, much commentary. That's a perfectly healthy thing, but at some point you've got to get on, pick the strategy and push forward and get it done, and that's exactly what we are doing.
Paul Little, the chair of your advisory committee on COVID, says the blunt restrictions have caused too many unintended consequences in the community.
Well, I wouldn't agree with those comments. He's free to have his own view. I'm not particularly interested in having a debate from this podium with him or anybody else, really. But you know, he's got a view. He's put that view. That's entirely a matter for him. I think that he is. Well, we are all.
His advice to you, because he's on the advisory group.
You know, I haven't spoken to Paul, so he might have provided that advice to someone else. And he's perfectly free to have a view, whether he furnishes it as advice or not. That's entirely a matter for him. I would make the point, though, that in broader terms, we know that every single decision that's been made throughout this pandemic, every rule we've had to put on, every restriction we've had to enforce, every part of this, there's a cost. Absolutely there is. And sometimes that's measured in dollars, sometimes it's measured in anguish and hurt. We know and understand that. And that's why everything that Victorians have given has to count for something. And being open for 5 minutes only to be closed again will mean that all that work, all that pain, Nick, will count for nothing. So that's why we've got to stay the course. That's why we've got to be determined. This won't be easily overcome. It's a stubborn virus. It's wicked. It moves silently and swiftly. So we can't be changing, you know. There's a strategy there for a reason, and we need to stick it out. We need to get to the end of this, and we will. Just look at where regional Victoria is. Many would have thought that was not possible. Many would have thought that was not possible even a week ago, but it is, and we will hopefully have some very, very important announcements to make early to mid next week, and then move to a situation very quickly where regional Victoria will be essentially open. That is proof positive that this strategy can work, is working, and will continue to work.
Premier, some businesses say that they can't survive without another government cash injection. Can they bank on some sort of grant program similar to the previous rounds of about, I think, $10,000 for? As
I've said a few times this week, we are putting the final touches to a very significant package, and we will have more to say about that soon. And there's been very significant industry input into the sort of assistance that we're going to announce. There is a bit more work to be done. It's getting very close though, and I'm very grateful to all of those industries. None of whom are happy to be in the predicament they're in, and I'm not happy to have to confront the reality we confront either. But you know, you can have those debates. You know, if only anger and frustration worked against this virus, it'd be, you know, we'd be in a different set of circumstances. We aren't. We just have to see this through. But I know there's a lot of pain out there. There's a lot of businesses doing it tough, and we'll have more to say. And the package of support will be very substantial, and it has been well informed by the constructive discussions we've had with people from across the board, and I'm very, very grateful to them.
Even when regional Victoria does reopen and is operating as much as it can be, how closely and strictly will you be monitoring the borders between Melbourne and regional Victoria?
Yes.
And especially when it comes to the Chamber of Commerce has suggested today holding off on the grand final day public holiday, given it's not here in Melbourne, and potentially looking to put that later in the year when it's safe for people to travel, so that some business and some more economic...
Yeah, I've got no announcements to make about the grand final Friday public holiday. It'll go ahead as I've outlined. But in terms of regional travel, the 2 points you raised. Firstly, we will defend that border really, really tightly. We can't have a situation where regional Victoria gets to take not one but the 2 steps, gets pretty well opened up. We've got a different set of circumstances in Melbourne, much more virus in Melbourne. We can't have a situation where people are travelling for anything other than essential reasons into regional Victoria and movement both ways. So yeah, we'll have a lot of work's being done on that, and we'll have some further announcements to make about how that system will work. We know that there are a lot of people who move between Melbourne and regional Victoria for work and for other purposes, whether it be people that work in the health system, for instance. There's many thousands of nurses, for instance, that come from the regional Victoria, not that far out of Melbourne, but they travel in and out of Melbourne. We know it's inconvenient to be stopped for lengthy periods of time at roadblocks and things like that, but I think my feedback from regional Victorians, they're proud of the fact they've got such low numbers. They jealously guard it, and they know that keeping those numbers low is essential to keeping country Victoria open. So they want that border defended, and we will do that, and we'll have more announcements to make on that soon.
Is it not tempting disaster by having that holiday where it is natural? That holiday is actually one of the reasons it's designed originally, was to get people into country Victoria. Is it not tempting fate or disaster by having it anyway? Would it not make sense to delay it until...
Well, I don't see it as a risk, because you won't be allowed to travel to regional Victoria unless, of course, we've made decisions where we think that's a safe thing to do. So, we've got checkpoints at the moment. We've got a degree of enforcement. Police are doing a great job. I think we may step that up. It may go to a new level to make sure that only those who absolutely need to be travelling into country Victoria are doing that. There'll be a time for us to make further announcements, Nick, around supporting regional tourism. We know that we're not going to be having international flights leaving Melbourne for a very, very long time, it would seem. Who knows when a vaccine comes. But those who want a holiday, those who want to support businesses, those who want to get out of Melbourne, there'll be a time for that. And we'll have more to say about trying to support those regional tourism businesses so that they can get back to something approaching normal. Absolutely, that isn't today, and I don't think that's just a matter of the grand final arrangements. That's a much longer project, and one where we'll have a lot to say, actually.
What's the latest advice on indoor sports events and concerts like Rod Laver Arena and Melbourne Arena?
They're all in that last stage, or in COVID normal. But again, we will look at that. I've been asked a few questions about, the Melbourne Cup, 100th running of the Cox Plate, Australian Open tennis, Boxing Day test. These are really significant events, and people are really keen to get back to something approaching normal. It is very difficult, though, this far out to predict with any certainty what any of those events will look like. We just need more time, basically, to understand how much virus have we got, how's it presenting, what are the risks of having a crowd at size X versus Y. We're in constant discussions with all the different bodies who run those events, so whether it's Tennis Australia or the racing clubs. We will be able to, I know it's frustrating, but we'll be able to have more to say a little bit further down the track. We simply can't predict where they're going to get to now. If we could, we would. But I want Christmas to be as close to normal as possible. I want the Boxing Day test to happen. I'd like to think that we've got a chance that there'll be significant crowds there, but I can't announce that now because it wouldn't mean very much. But we'll have more to say quite soon about what summer in the city and what summer across Victoria is going to look like, And I think the mix of outdoor spaces being used for drinking and dining, the fact that we will have hit our targets and we're open and we've found that COVID normal, I think this is going to be a summer like no other. It is going to be absolutely amazing to see all of us pull together, looking out for each other, having defeated this thing by yes, staying apart, but by always knowing that we're at our best as Victorians when we stick together, when we look out for each other. And that's exactly what's happening. People can today, absolutely today, are in the 30s. People can be positive, they can be optimistic. This strategy is working. We're going to open this place up, and because we're doing it right, not popular, but right, it'll be able to stay open. And everything that every Victorian's given will mean something. And that's a proper strategy. That's not being fearful that people criticise you. It's not chasing praise. It's chasing and delivering a COVID normal. So that 2021, with sporting events and all the things you've raised, can be as close to normal as possible.
As we head towards those milestones, is there any thinking or any moves to reintroduce asymptomatic testing as well? Obviously, we're seeing more research globally about the number of cases that are transmitted from a lack of symptoms.
Sure. So a couple of points. The return on investment for asymptomatic testing is very low, so you've got to test a lot of people to find a very small number of people who've got it. However, there is a place for it. In high-risk workplaces, the close contacts of those who've got it, we do some of that. We may finish up doing more of that, particularly once we get open. So the notion of trying to have the clearest picture, there may be more of that. But the key point here, particularly in high-risk settings, but the key point here though is there are a number of Victorians who have symptoms, but they're not going to get tested. And I just ask each and every one of you, if you have symptoms, please go and get tested as soon as those symptoms start, even if they're really mild. Go and get tested. It's such a big thing you can do, simple thing, but it gives us the clearest picture of what we're up against. And it's always really tough to try and defeat something that you can't see, moves rapidly, and you've got, there's more of it out there than perhaps people are coming forward and getting tested and proving for you. So particularly in regional Victoria, and particularly when they take those steps next week, that real vigilance. Any symptoms, get tested. That won't mean that you get locked down. It won't mean that opening up takes longer. It just means we've got the most accurate picture, particularly for regional Victoria, to continually monitor those positive cases, to trace and to lock those people, to put our arms around those people, make sure that they are completely safe and that they're not spreading it to anyone else. That's how regional Victoria will stay open. If you don't get testing numbers that are high enough, if people make a judgment, which would be exactly the wrong judgment to make, I won't get tested because my positive case might be the one that stops us opening up. No, exactly the opposite. If you come forward and get tested, that gives us a complete picture. We can make much better decisions. We can understand the backstory behind your positive test, and we don't finish up in probably the worst position you can finish up in. And that is where, instead of testing giving you a picture of how much virus there is, the number of people presenting to hospital, gravely ill, that becomes the proxy. We don't want that. We've got to keep these test numbers up, and that's why I'm so proud of everyone who has gone and got tested. And I just again say, any symptoms, please come and get tested. It's a massive thing you can do, even if the symptoms are mild, and as soon as you get those symptoms. Any other issues?
The protest today,
Yes.
there's looking to be a number of people gathering at the Tan, Fitzroy Gardens. What's your thoughts on their actions?
Selfish, unlawful, and wrong. Absolutely. It's not smart, it's not right, it's not lawful to be protesting. Now is not the time for protest. No one has the right to make choices like that potentially puts at risk everything that everyone's given and everything that we're working towards. Instead of having protests, let's do everything we can to not spread the virus. Let's keep following the rules, keep getting tested, and then we will move through, take these safe and steady steps, just like regional Victoria is about to next week, and we can get the place open and we can keep it open. That's the only way to do it. If there were other choices available to us, then we would have made those. But no Victorian has the right to act in that way and put at risk everything that the vast majority of law-abiding Victorians, decent Victorians, have given. All the sacrifice they've made should not be frittered away by anyone making a selfish choice that they can protest. You can't. It's not appropriate. It's not lawful. Look, I don't know if I can be any clearer than that. And Victoria Police will be pretty clear as well. They've got a job to do, and they will do it.
A number of people watching just want the simple answer to the question, if we can. If regional Victoria jumps and goes to the second,
Yes.
in broad terms, what sort of things will the people in regional Victoria?
Oh, well, you
have?
finish up with. So they're at 4 reasons to leave home at the moment. There's no curfew there. They've got a range of different settings. But what you'll finish up with is pubs, cafes, restaurants. They'll be open. There'll be a mix of inside and outside. You will have. You'll be able to leave your home, and you'll be able to do so for any purpose, really. You finish up. They're not just taking one step; they're taking two. So they pretty much finish up open across the board, and people get to go and do the things that they have been craving for a long time. There'll still be some rules, though. There'll still be COVID-safe plans. Lots of those high-risk industries will still have rules that they have to follow. But the way regional Victorians live their life, it'll be much closer to normal than it's been for a long time. Everything from being able to go and have a coffee, buy a meal, have a beer at the pub, all of those things will be able to happen again. And that's proof positive that you can open up and stay open if you drive the numbers down to the lowest level. I'll get you the full page of all the things they can do, because there are more things than that. I'll get you the full page from the roadmap.
And how far ahead of schedule?
Well, we didn't put a date on it. We didn't say that because we knew that it would be relatively quick. We didn't think that we'd have to wait 6 or 8 weeks. So we've still got a few days to get to the 14 days. It could be the middle of next week. We're hopeful that that's when they'll be able to take those 2 safe and steady steps towards COVID normal. And that's a reflection of the strategy. It's a reflection of how hard regional Victorians have worked. And it's about hope and being positive and seeing what's been able to be achieved in communities as vast and diverse as regional Victoria is. It can work there, it is working there, and it's going to work in Melbourne too. We've just got to stay the course. We've just got to find it in ourselves to see this through and see this virus off. That's what we have to do. And I'm confident we will. Very good. I'll leave this time. Thank you. No more. See you tomorrow.